I'm currently the clinical nurse specialist for the operative care division at the Portland VA Medical Center. Clinical nurse specialist operates in basically three spheres of influence. The first sphere is the patient sphere, and in the patient sphere, you do direct patient care. There are some CNSs that are diabetic CNSs where they hold clinics and see patients directly and deal with the majority of their needs. There are nurses that are also wound care specialists that see patients in clinics and also see them in the hospital. So that's the patient sphere. The nursing sphere is the second sphere, and that is where clinical nurse specialists act as mentors and leaders and help guide and direct nursing practice both in the hospital and out of the hospital to ensure that we're doing the best evidence-based practice nursing possible to achieve the greatest outcomes possible. The third sphere is the organizational sphere, and that is where you operate within an organization such as what I do in the VA, work across different systems. So I work with the anesthesia providers as well as the surgical providers and nurses to ensure that we have the best outcomes for the patient across the perioperative phase within the institution. I also am on many institutional committees and boards where we're dealing with organizational issues that will affect all of the hospital and make sure that we are getting the best outcomes for our patients. Sort of as many clinical nurse specialists do, I spent many years as a nurse doing this. So I had about 20 years of experience as a perioperative nurse, doing a little bit of tissue banking on the side, and as I was pursuing on with my career, I decided what did I really want to do, and I loved nursing and looked at the different advanced practice roles and found that the clinical nurse specialist was a role that fit me best. I've now been in this field for a little over 7 years as a clinical nurse specialist. To be a clinical nurse specialist, you have to have either a master's or a doctoral degree. You have to be prepared as a clinical nurse specialist. So there's the consensus model out there for advanced practice nurses that deals with all 4 of the advanced practice nurses. And it basically says that you have to be educated in your role, which would be the clinical nurse specialist, and a population. So the population would be either family across a lifespan or adult gerontology, pediatrics, neonatology, gender-specific, or psych-mental health. So you have to become educated in a role and a population. There's a variety of issues that can happen. Most of them are dealing with how systems function. So nurses can come forward and say, I thought this is how we were going to deal with these types of patients or deal with this sort of process, such as the briefing or the timeout that is done in surgery, and there's a glitch, and I have to intervene with either the surgical providers or the anesthesia providers, or even with nurses saying that we need to all get on the same page, or we have to look at maybe how do we revamp this, because in this particular instance, the way we perform the briefing or the way we perform the timeout is not getting us the information we need to provide the safest possible care. I think you have to have a lot of confidence in yourself, have to have confidence in your nursing knowledge and your understanding of what the nursing practice is. I think you also have to be one that rolls pretty well with the punches, because things can change pretty rapidly from minute to minute, and not get too excitable as you're put in different situations. So one that's pretty easygoing, but as we say in the operative care division, on my name tag it says Stephen Patton OCD. So you have to be fairly obsessive and compulsive, because you're dealing with issues that need to be resolved with some due diligence with it as well. So I think you have to have both of those abilities to be laid back and calm as you approach things, but also be a little bit obsessive compulsive. I wish they would have talked to me about it well before earlier in my career, because I would have jumped at this probably after being a nurse for 10 or 15 years as opposed to waiting to 20 years. I really did not know about the CNS role until I started investigating the different advanced practice roles to see what was out there and see where I wanted to pursue my education. And I went, wow, I didn't know this existed. There were several CNSs in the hospital, but being part of operative care was sort of locked away behind those double doors in the OR and didn't get to get out and about in the hospital. But once I started meeting with these other CNSs and exploring the role, I said, wow, this is what I want to do. So I've been very blessed in getting into it and moving forward, but I wish I would have known about it 10 years earlier. The field in general is that right now there, as you know, and everybody knows, the healthcare industry as a whole is facing a bunch of challenges. But it's getting that out to the legislators and to the people that are making the decisions about how we're going to progress with healthcare reform to ensure that the CNS is seen in that vision and that the CNS's special attributes and talents are brought forward, because I think, again, we can solve many of the healthcare issues by improving patient outcomes, reducing costs, and having nurses work to the fullest extent of their licensure, as the IOM report says. Most recent change, again, is the consensus model for all the advanced practice nurses that finally, after years and years and years of not being able to define what is an advanced practice nurse and what are the different roles and how are they going to be licensed, accredited, certified, and educated, we've gotten together and putting that model together. It doesn't quite fit any of the different roles exactly, so there's some massaging that is taking place as we're trying to implement this across state to state to state. And that probably is the biggest change right now, is that some states have always licensed CNSs. What started out as trying to get everybody on the same sheet of music is basically ended up the same way we've been in the past. Different states are implementing it differently, and that's probably one of the biggest changes right now, is we're trying to look forward and see how we can best move the states together so that we have consistency, so CNSs can move from state to state to state and practice in the same manner. I think the future is bright. Again, with the healthcare reform, CNSs are positioned to be a great part of that because of how we look at systems, because of how we look at nursing, and because how we deal with direct patient care. We are suited in all three of those different fields to enhance whatever regulations come down or whatever changes come down to the healthcare system. We're there to implement those and to ensure that we're achieving the best quality care for patients as they move through the healthcare system. I think that simply to be a member of your professional organization is a responsibility of every professional. The National Association of Clinical Nurse Specialists is an organization that represents CNSs regardless of their specialty. Secondly, it's a great place to network. As I said, from state to state, there are many differences. So it's very nice to be able to make contact with people from other states and see what their practice is like and how they are implementing some healthcare reforms in their states and changing either the statutes in their state that regulate nursing practice, or looking at rules amendments, how their State Board of Nursing is set up to make sure that the CNSs can work at the full extent of their licensure. And then thirdly, we've put on a great conference every year. Our last conference was in Baltimore in March. We had over 550 CNSs attending. There was great camaraderie. There was a great amount of networking going on. Some fantastic papers were presented, and I think people were extremely excited when they left the conference. So I think those are the three main reasons to become a member of NACNS. I would say find a CNS in your state to see if you can connect with them. If you're having a difficulty with that, contact NACNS, and they can put you in contact with a CNS in your local area. spend some time with them, see what they do, see if it's a fit for you, and pick out a mentor that you can have with you for a while to come as you get through school and start your actual practice.